Hello, myself Ruti Modi. Today I'm going to explain you about the Ortolani test. Ortolani test is a physical maneuver used to detect hip dislocation in infants and children. It assesses the hip joint stability and can identify a dislocated hip that can be reduced, returned to its normal position. Positive Ortolani test is indicated by a palpable or a audible clunk as the femoral head reduces into the acetabulum, representing reduction of a dislocated hip. So, how Ortolani test is performed? First, positioning. Baby is placed in a supine position with hips and knees flexed at 90 degree. Second, examiner's position. Examiner places their thumb on the medial thigh near the groin crease and their index and long fingers on the greater trochanter laterally. Third is the maneuver. The examiner gently abducts the hip being tested while simultaneously exerting an upward force through the greater trochanter. So, how we can interpret it? So, interpretations are positive Ortolani test, a palpable clunk, that is a sudden feeling of a sound of a hip moving back into its place, indicates that hip was dislocated and has been reduced by the maneuver. So, what is negative Ortolani test? That is, no clunk is felt, suggesting hip is not dislocated. What are the contraindications of the Ortolani test? First is the age. We can't do Ortolani test on the first few months of their life, that is typically up to 3 to 6 months. Second is joint stability. If there is no joint stability, we can't perform the Ortolani's test. Third is false positivities, that is breech delivery. Infants born in the breech position, that is bottom first, are at the higher risk of the false negative test of Ortolani test, requiring subsequent ultrasound screenings. Thank you.